nothing but the patient illness. Procedure is nothing but treatment given to the patient. These are nothing but while giving the procedure, we will be using some DMEs, durable medical equipment. We all know that, right? Like cotton or any bands, injections like that. We will be calling them as supplies. All these things we are going to convert into code format. This is what medical coding is.
So now we'll see how they convert into codes by using software. So we had to code a language like that. It's not like coding in IT. So this is a healthcare IT jobs. Okay. So we are not coding anything because already we have the books. From the books only we capture the codes. Okay. So coming for the book, the first book is ICD. So in this ICD book, we can find all the diagnosis. Whatever the disease is there, every disease global. This book is not restricted to any single country. So this book is accepted globally. So all diseases we can find here. And next second book is a CPD book. In CPD book, we can find all the surgeries. For example, when patients coming for any lung disorders, maybe doctor can remove a portion of the lung, they can remove the fluid, right? Whatever the treatment they are providing, all treatments we can see in which book means CPD, current procedure technology. And next third book is a HCPS. So to put all the supplies, healthcare common procedure coding system, everything. Like for example, we are using any injection from hospital, or you taking any drugs, or like even ambulance, bed sheet, like bed cloths, so wheelchairs, walkers, everything, all supplies, everything is a chargeable that we can find in the HCPS book. Okay, so we are not doing any coding here. So already codes are there in the book itself. From the book, we used to take, we read the documentation, we assign that one. Okay, so what are the 3 books we are using? CPS. So I'll ask one question, just say which book will take the code. So patient is coming for pneumothorax. Okay, and doctor did like paracentesis, like they put the floats at thoracentesis. So thoracentesis is surgery. From which book we have to take the code? It is surgery, right? And the disease condition which should take from? Great.
Very good, guys. So finally, as we already discussed, medical coding is nothing but conversion of patient medical diseases, treatments and supplies into alphanumerical codes. You can see here ICD code, CPT code and HCPCS code. So as I said, we are not going to generate the codes. We already having all the standards of codes, but we should have the knowledge to select appropriate code that you are going to learn in this session. Okay, so ICD code, CPT and HCPCS. You can able to see that? Yes, this is what medical coding is.
So next, when you go for any interviews, the first question they'll ask is, what is medical coding? You should say it very properly in simple language. So what medical coders will do, we'll read the documentation, and from the documentation we'll find out all the diseases, all the surgeries and supplies, and we are making into small codes. With the help of codes, only insurance will pay the money to the doctors. Okay. So now we'll see a sample. Okay. I think most of us we used to visit hospitals, right? Maybe our parents. We also used to visit hospitals. The similar format we can see in US also. Okay. Predominantly we are coding for US patients, not for Indian patients. ఎందుకంటే ఇండియాలో ఇంకా ఫుల్ ఫ్లెడ్జ్ కోడింగ్ చేయలేదు అన్నమాట బట్ బికాజ్ వీ డోంట్ హ్యావ్ మచ్ ఇన్సూరెన్స్ ఇన్ ఇండియా బట్ యూఎస్ 98% పాపులేషన్ విల్ హ్యావ్ ఇన్సూరెన్స్ ఓకే సో కమింగ్ ఫర్ శాంపుల్ డాక్యుమెంటేషన్ ఇఫ్ యూ సీ దిస్ చార్ట్ ఐ హోప్ ఇట్స్ విజిబుల్ టు యూ సో వాట్ ద రీజన్ ఫర్ అడ్మిషన్ ఇస్ నీ పెయిన్ సో పేషెంట్ హాస్పిటల్ ఎందుకు వచ్చారు నీ పెయిన్ సో నీ పెయిన్ వచ్చినప్పుడు డాక్టర్ విల్ ఆస్క్ ద క్వశ్చన్స్ రైట్ సో హౌ మెనీ డేస్ యూ హ్యావ్ ద పెయిన్ or any tablets you are taking, they'll ask some questions. A questions anta మనం చెప్పినప్పుడు ఆ డేటా అంతా హిస్టరీలో డాక్యుమెంట్ చేస్తారు. So what is history means? Whatever the problem you are suffering, that will explain to the doctor. So once they are taking the history, so what doctor will do means they will examine all your systems. That is, they can take a stethoscope or any instrumentation. They'll check your body system. So once they find out the issue, they can write finally you are suffering from so and so problem. Now you can see the final assessment. What is disease the patient suffering? What's the name? Osteo. What is the medical term for bone? So bone for medical term osteo, and joint medical term artho. So artho ante joint anamata, bone is osteo, and inflammation itis antam. So it is called osteoarthritis. Ante patient ki bone and joint inflammation, that's a disease condition. So knee pain is a symptom anamata. If it is a symptom edi condition ante symptom is a knee pain and condition is osteoarthritis. So osteoarthritis is the disease or surgery? So we have to take this code from which book? We have to capture this code from ICD book. Okay. And what treatment they provided for this patient? In treatment ఇచ్చారు సర్జరీ చేస్తారా టాబ్లెట్స్ ఇచ్చారా ఇంజెక్షన్ సో దే గివెన్ సమ్ టాబ్లెట్ ibuprofen రైట్ అంటే మీ నీ పెయిన్ కోసం డాక్టర్ ఒక టాబ్లెట్ ఇచ్చారు సో దాన్ని చేసి డాక్టర్ పేమెంట్ వస్తుంది ఈవెన్ బెస్ట్ ఎగ్జాంపుల్ మీరు ఒక హాస్పిటల్ హెడేక్ వెళ్ళారు అనుకోండి ఒక డాక్టర్ వచ్చి టాబ్లెట్ ఇచ్చారు ఇంకొక డాక్టర్ ఇంజెక్షన్ ఇచ్చారు ఏ డాక్టర్ ఎక్కువ పేమెంట్ ఇస్తారు సో బికాస్ బేస్డ్ ఆన్ ట్రీట్మెంట్ if they're given more treatment will get more payment if the patient got admitted to hospital because admitted again will be more costly right so you should read the document very carefully and you have to capture all the diagnosis and procedures then only doctor will get the proper payment so medical coders valle doctors payment వస్తుంది ఒకవేళ డాక్టర్ ఓపెన్ హార్ట్ సర్జరీ చేశారు ఆ సర్జరీ 10 lakhs కాస్ట్ but you don't know how to read the documentation and you given some surgery simple surgery like 1 lakh surgery doctor will be in loss of 9 lakhs right మీరు ఇచ్చే కోడ్ వల్ల డాక్టర్ సాలరీ పేమెంట్ డిఫర్ అవుతుంది దట్ ఈస్ ద రీజన్ క్వాలిటీ ఇస్ మోస్ట్ ఇంపార్టెంట్ మెడికల్ కోడింగ్ అందుకే మాక్సిమం దే ప్రిఫర్ లైసెన్స్ గ్రాడ్యుయేట్ ఆర్ వెరీ గుడ్ ఇన్ ద అనాటమీ అన్నారు సో మీకు చదవడం తెలియకపోతే యూ కాంట్ టేక్ ద కోర్స్ రైట్ ఇఫ్ యూ నో వాట్ ఈస్ ద డిసీజ్ కండిషన్ హౌ యూ కెన్ టేక్ ద కోడ్ ఇన్ ద బుక్ సో క్లియర్ సో హౌ ద డాక్యుమెంట్ విల్ బి మీన్స్ like reason for admission and what your doctor given the treatment so okay so again we'll see the other sample charts so as of now we discussed like what is medical coding and what are the books we are using and how we are taking that so in detail we'll explain now.
So we are now discussing like medical coding like that. So in India, do we have medical coding? But we have healthcare. Yes. So we will differentiate now how Indian healthcare differs with other countries. So first of all, coming to Indian healthcare, if the patient got any disease, ఏమైనా problem like fever కానీ, abdominal pain కానీ, chest pain కానీ ఏమైనా వచ్చింది అనుకోండి, we will be